Thanks again for tuning in to the Gym Bag Journal podcast. I am your host, Coach Brandy, and today we have our special guest, Dr. Rachel Moore, PT, DPT, CFL2, I know what that is, and Cert-CMFA. What are all these acronyms?
PT is my license. DPT is Doctor of Physical Therapy. CFL2 is CrossFit Level 2 instructor. And then Cert-CMFA is a certification through the Institute of Clinical Excellence, which is the continuing education company that I teach with. And it is certification in clinical management of fitness athletes. So it's a specialization in CrossFit and fitness athletes.
That's awesome. I was going to ask, are there any more acronyms that we don't have here? Okay. Okay. When did you get that?
All right. So it's a newer cert that just recently came out. So the company started out with just an online course and then added in a live course. And now there's a level 2 course. And so as all of these courses have been added in, the company created the certification to kind of put forward to the public of like, hey, this person has done the work and taken all the courses and done the thing to be the best that they can be. And so that rolled out a few months ago. And so since the induction of that, because I had taken those cohorts of those courses already.
That is very impressive. And on top of doing all that, you're a mom of 2.
Yes.
And you're actively coaching CrossFit.
Yes.
We'll get into how you juggle all of that. But first, we're going to start with your journey and founding Disrupt Physical Therapy and Wellness. Can you share your personal journey that led to that?
Yeah, for sure. So Disrupt Physical Therapy and Wellness is my physical therapy practice. It's an out-of-network practice located in Spring and the Woodlands. And it is a fitness-forward pelvic floor and orthopedic practice. So I started it basically because I was so burnt out in doing clinical care at the clinic that I was at down in the Heights. I was running a clinic for like a typical insurance-based clinic that was high volume and all they cared about was productivity. And I was going out and marketing and trying to make all these new connections and commuting on top of that. And it was before I had kids. And I was just like, there's got to be something else to this. Like, I'm unhappy commuting. I'm unhappy busting my butt for everybody else. And I'm not treating patients the way that I want to treat patients. It was very like insurance dictates your plan of care. They set the number of visits that you have. I was having to see multiple patients at a time. And so I couldn't really give anybody the attention that they deserved. And so that was kind of the launching point of starting Disrupt. And I actually ended up seeing the old owner of the gym that I was working out at and hurt his wrist. And so I was seeing him just kind of on the side after classes to help with his wrist mobility and get him back into CrossFit. And one day I was like, I'm tired of this. I want to start my own practice. And he was like, well, where would you start the practice? I was like, oh, no. And it was kind of this like back and forth. And it ended up like, well, do you think you want to just like put a table up here? And it kind of grew from there. So I literally started with a table in the corner of the office, and it has grown into having my own space and multiple locations and a physical therapist that works with me as well. So it's grown so much over the last 5 years.
That's awesome. And so that gym that you had the table in the corner, is that where you are now still?
Yeah.
Okay. And I know there was some growth happening when I was there. Where is that right now?
So I have my office in the gym. The whole inside area of the office is like a recovery area now. And then I coach at the gym. So I'm there coaching 3 days a week. And then the gym itself has just like blown up. It's like 150 plus members now, which is really exciting to see. So lots of people rolling in and just like, it's crazy. In the classes, they used to be 3 to 5 people in some classes, and now it's like consistently 16 to 20 in most classes.
Do you find yourself just like standing there watching people like they need to come see me?
I feel like I shouldn't say yes, but kind of. There's definitely sometimes that I'm like, that person probably got some shoulder pain and they're probably going to end up on my schedule. And I always joke anytime there's jump ropes in the workout and everybody like runs to go pee, I'm like, hey, go ahead and book on my schedule, whatever. But yeah, it's nice because like I can give people feedback and instruction as a coach. And then if I'm just there, like, and somebody gets hurt or somebody's like, oh, my shoulder, can give them a couple ideas on things to work on. And so I think for the community of the gym itself, it's been really great. At least that's the feedback that I've gotten, is that you get that like balance of having somebody there that knows their stuff. And also, if that doesn't help, can then help you rehab and get better.
Yeah. You mentioned people jump ropes and bathrooms, and this has been an issue for me. And I think a lot of probably men, but some people think women shouldn't have that issue if they haven't given birth yet. But I remember right before the open workout that had jump ropes, I ran up to you and I was like, how do I get through this without peeing on myself? And you gave me some feedback. Yeah. So, I mean, it's not just people who have had kids, because I experienced that too. But I appreciate that feedback. I think I had I wrote a blog post years ago about that issue because I had just found Knix. Have you heard of like their undergarments? And they're like absorbent. So I wrote a blog post about those for that reason. But you know what's better than buying expensive underwear? Just fixing yourself. Exactly. All right. Your journey into pelvic health began during your own pregnancy. How did this experience shape your perspective on women's health and wellness, and why do you think it's often overlooked?
Yeah. So I started looking into just pregnancy and exercise when I got pregnant with my daughter. I'd been doing CrossFit for like 2-ish years, a year and a half. So I was still relatively new and doing every workout scaled and just really getting all these skills. And I wanted to continue, but I had no idea like what I should or shouldn't be doing. And of course, if you ask like most OBs or anybody, really, they'll be like, oh my gosh, you shouldn't do that. That's too much. It's too intense. But it just didn't sit right with me. And as a PT, I feel like I have this kind of like distrust of the medical system as a whole. Like I see all the ways that you guys advise people poorly in all of these other situations. So I don't think I'm going to buy that I shouldn't be exercising now. And so I started looking into it. And what I found is that there's really wasn't a lot of information out there, period. So not only was it not a lot, what was there, it was conflicting. And so one thing would say, do this, don't do that. And then another like blog article would say the literal opposite. So that's kind of what led me into the pelvic space to start, was like, I need to learn how to continue exercising for myself. From there, I had my daughter, and then postpartum side of things, I was like, oh man, like I have no idea what I'm supposed to do. And started looking into postpartum rehab. And then that just kind of segued into all of pelvic. So for about a year, I did, I call myself like an external pelvic floor physical therapist. So I hadn't taken any courses on internal assessments, which is a vaginal assessment, wasn't trained in that. And then about a year in, I was like, all right, it's time to just rip off the Band-Aid and learn all the things, because I'm only like at the tip of the iceberg right now. And there's all of this other stuff that I need to know. And so that's really what kind of led me into that path. I feel like for the longest time in the prenatal space, especially, the answer was, we don't really know, so let's err on the side of caution. And so advising from physician standpoint, from even like a CrossFit coaches, like nobody really knows what is and what isn't okay. We're always going to err on the side of caution, especially when there's like a human life or 2 human lives involved in the situation. And so now in the last 5 to 10 years, the research in this space has exploded. And because it's exploded, it's like, we can't use that anymore. Like, that's not an excuse. We have the information, and it's up to us to know the information and be able to give solid recommendations on exercise and pregnancy and what is safe, quote unquote, what is okay, and then getting back into things postpartum as well. So I think for the longest time, it was coming from like a place of, well, we just want to be safe. And now I think it's truly coming from a place of like out of date information. And so it's really kind of falling on rehab providers, physicians, and everybody else. Like, we need to do better to disseminate information to people so that they have that information.
I've heard before people would say if you're already working out and you become pregnant, then it's safe for you to continue working out, but that you wouldn't want to start working out when you're pregnant. Do you agree with that?
Absolutely not. And that's exactly it, right? Like, for the longest time, it was like, well, you're probably fine because you did that before. But the American College of Gynecology advises that everybody exercises in pregnancy, because we know there are so many benefits for mom and for baby as far as health outcomes in the pregnancy, in the delivery. And even now we're seeing like long-term benefits for baby for moms who had exercised in pregnancy.
Really?
It's wild. So now that we're getting more and more information, a big part of that is that for the longest time, like, women weren't really studied at all because
right.
they're complicated and hormonal and whatever. And then pregnancy wasn't really studied because of the 2 lives thing. Nobody's going to do experimental design on pregnant people. And what kind of came out is like people are doing this thing. Like people are exercising when they're pregnant. So why don't we just ask the people that did that and see what their outcomes were, and then kind of make our recommendations from there. So it's kind of like where the research really started. Once we had that data, then it's like, okay, we know that it's safe. Like we know there's no adverse outcomes. Now let's start manipulating this data and do studies where we like have groups that do resistance training and don't, and all of that, and compare that data, which is just higher quality level of evidence to really kind of lean into. But yeah, I think that that specific recommendation is still given. Like I was given that advice when I was pregnant with my daughter, and she's about to be 5, and it was like, oh yeah, you do CrossFit, just, like tone it back a little bit, but you're okay. If you hadn't, like, if you weren't already doing this, we wouldn't tell you to start. Or we need people to exercise. Like our country doesn't have a movement problem, it has a lack of movement problem. And any barrier that can be put up to exercise is a negative in my mind. So I'm like all about empowering people to find the way to move that they like. Doesn't mean everybody should go out and do CrossFit if they don't want to do CrossFit.
Right.
That's my preferred way to exercise, but that's just my preference. But everybody should be doing some form of exercise that makes them happy because of all of the health effects.
So I want to ask you, you said there's benefits for the baby too. What kind of benefits are they seeing for the baby?
So there's a couple of studies. I haven't looked into them in like full detail. So this has just been like in glancing. There's a couple studies that look at like mental health on a long-term scale, but like insulin, like resistance levels and more of like the metabolic side of things. I've seen studies that are looking into that.
Okay.
Again, haven't dove into them specifically, but I have looked at specifically like labor studies and studies looking at how babies that were or that are born from moms that exercise tolerate labor compared to women that didn't exercise, and the babies that are born to the women that had been exercising to whatever intensity in pregnancy tolerated labor better, meaning they had less like fluctuations in heart rate, less dips in heart rate. So that's pretty fascinating, especially because most of the interventions in the birth world are because like baby's not responding well to labor. So if we can get rid of that, then maybe there's less interventions, and that's just like a whole cascade of potentially better postpartum outcomes for mom.
That's really interesting because, you think when you exercise, of course you're helping yourself, but to be helping your child too, that's news to me. That's awesome.
Yeah, it's really cool. I'll have to find those studies. I'll send them to you so you can like link them in your podcast. But there's definitely research coming out about just all of this because we're getting so much data now. Like we can really dive into things because we have this cohort of people that have done the thing.
Yeah, and how exciting that you get to be like right on the forefront of that. That's so
really
cool.
It's fun.
That's awesome. So you mentioned like having less interventions during childbirth. I think that takes us to our next question about holistic approaches to wellness. What does holistic care mean to you, and how do you integrate this philosophy into your practice?
Yeah. So holistic care to me is like looking at the whole person, right? Like your shoulder's hurting. Not just only going to look at your shoulder. Like I'm also going to look at your neck and your back and all of the ways that you're moving. And we're going to talk about how you're sleeping, and we're going to talk about how you're managing your stress. And we're going to talk about all of these other pieces of the puzzle because everything comes together to make one picture. So if we only hone in on like biomechanically, I think your shoulder is doing this thing, but we neglect the fact that maybe you've increased your training volume and you haven't been sleeping and you've been really stressed out. All of that is a recipe for increased pain because we know that pain is affected by all of those factors. And so the holistic approach is really taking that step back and looking at the entire person and all of the pieces that could play in, whether that's for an orthopedic injury or orthopedic concern like shoulder pain or like postpartum leakage. That's not just a pelvic floor problem, quote unquote. Like we look at people's hips, we look at their knees, we look at down to their big toes, how they walk, how they move, because everything is connected.
Okay, that's awesome. Okay, so CrossFit. We got to talk about CrossFit. So as a PT, how did you find CrossFit, or which one came first in your life?
Oh gosh. Okay. So in PT school, I guess a little bit more backstory. I never worked out like at all in college. Like I've been like lucky to be stick skinny for my entire life. And I say lucky, like it was hard to like gain weight, which is such an annoying problem to have, but it's still a problem. So
It's a problem.
So anyway, stick skinny my whole life. Like I look back at pictures and my arm is like the size of my wrist. I'm like teeny tiny. And I met my husband in college. So we were dating all through college. And when I went to PT school, we were like, okay, like we're real grown-ups now. We're going to go to the gym in the morning. So like 5 a.m. every day, we would wake up and go to like 24-hour fitness or whatever. We started doing like bodybuilding style workouts. And that's what we did for like 3 years when I was in PT school. And towards the end of PT school, like probably 2.5 years in, Bobby started watching the CrossFit games. And he was like, oh, I just think this is so cool and I really want to do it. But I had heard all of the negative stereotypes about CrossFit, right? All of that. I mean, PT professors like joke like, oh, CrossFit keeps us in business. And so I was like, no, we can't do that. That's ridiculous. I remember being at like a sports bar with my in-laws, my mother-in-law, my father-in-law, and Bobby. And we were all sitting there like eating buffalo wings and drinking beer. And they were doing like thrusters or something. And Bobby was like, man, that's so cool. And I was like, let me tell you all the reasons that is stupid. Just get off about it because I had no idea. But I was also really bored with what we were doing. And, you know, like it just gets monotonous doing the same thing all the time. And so we moved. I graduated PT school in May of 2014. And no, sorry, 2017. Math is hard. And we pretty much immediately moved to Houston. So I'd gone to PT school up in the DFW area, graduated, took a job doing like PRN coverage for somebody. And then like 2 months later, Bobby got transferred. And so we moved to follow his job. And we moved here. And we didn't have any friends. Like we didn't know anybody. So we joined a gym and we were like, okay, we're going to join this like warehouse barbell gym, whatever. And we're going to work out there. And we'll make friends like through the gym. And nobody freaking talked to us. Like everybody was there. They had their headphones in and they were doing like their workouts, like posing in the mirror, and like nobody talked to each other. And so we were there every morning for like, gosh, I don't even know how long, like 5 months or so, 4 or 5 months. And this whole time I'm like, okay, maybe we can look into something else. And then I actually took an ICE course. So the company I teach with, they have a continuing education course called Clinical Management of the Fitness Athlete. And I had reached out to a PT that graduated from the same program as I did. And at the time, it's really funny how life takes you weird journeys. At the time, I wanted to work with disabled veterans. Like that's where my heart was. My dad's a disabled vet. I wanted to give back. And so I was really interested in working specifically with like amputee population. And so I had messaged him. I was moved here, had no idea what I was going to do, couldn't find a job. Was a new grad, and I messaged this guy and I was like, hey, this is what I want to do. Like, do you have any idea what I could do? And he's like only out of school for like a year. I don't know why I thought he had all the answers that I did. And he told me like, check out this course, which was the Clinical Management of the Fitness Athlete course, and sent me the instructor's information. So I messaged him, told him, hey, this is what I want to do. Do you think this course would be applicable? Or like, am I just like, this is not even the route to go? And he messaged me back and he was like, yeah, for sure. Like we teach the squat, we teach the deadlift, we teach overhead pressing. Like all of this is beneficial. For sure, you should sign up. So I signed up for their online course, and it was an 8-week online course where they broke down all of the foundational movements of CrossFit. It's kind of like the CFL1, but with a PT spin. So it's not just like, here's the movement. It's here's the movement and the points of performance. And if people aren't meeting the points of performance, these are all the PT tests that you can do to figure out why, or if they have pain with it, to figure out why. And so it's kind of a hybrid geared towards PTs. And so I took that course, and it's funny because at the time we had to do weekly videos for homework. And so we would have to record ourselves like squatting and deadlifting and doing cleans. And I'd never done a clean before in my entire life. And we would critique each other's videos. And I still get them popped up on like a time hop or whatever. And I cringe because they're so bad. Because I'd never been coached in anything before. Like I was just moving.
Well, don't cringe. You should be proud. Like, wow, look at what I'm doing now.
Actually, yes. We've come a long way. But yeah, so that's kind of what got me into it. And so then I ended that 8-week course. And by the end of it, conceded to Bobby, like, okay, we're not broke anymore because I have a job and we need friends and we want community. So why don't we check out a couple gyms in the area? And we had gone to watch a class at Overtake where I'm at now and met Alex, and immediately we're like, okay, this is great. This is where we're going to stay. And we've been there ever since.
That's awesome. You mentioned that, PTs will say CrossFit keeps us in business. I tore my hamstring a couple years ago and I was going to physical therapy once a week. And the first time I went, the lady she basically said that. She was like, CrossFit's so dangerous. Why do you do that? And every week I came in, she was like, you really just need to do Pilates. You really need to do Pilates, like every week. And I was just like, thanks, but no thanks. I like picking up heavy stuff.
Not to bash Pilates. Sure, do you like Pilates? Do Pilates, but also not everybody wants to do Pilates.
Exactly.
Like, no. Oh, gosh. It's so funny seeing, like, anytime the group that I teach with shares any, like, studies about injury rates in CrossFit or anything, like, their posts like blow up. And it's like controversial, and it shouldn't be because there's data about it. Like, this has been studied now. It's not any more dangerous than like football or even like running. Like, people just accept if you're going to train for a marathon, like, you're probably going to get hurt at some point.
Of course.
But for some reason, like, that's not considered dangerous.
Yeah.
CrossFit is dangerous. Like, it's silly.
You can get hurt doing anything. Honestly, I pulled my my groin trying to jump over a puddle of water one day after school. That was embarrassing to have to go into CrossFit and be like, well, I'm injured. Why are you injured? Well, I tried to jump over a puddle.
I pulled mine a couple weeks ago sprinting through the airport. Like, I was running with my suitcase and like tweaked my groin. So totally. I've never been injured. Knock on wood.
Yeah.
Never been injured doing CrossFit, but injured doing a lot of other things.
Yeah. That's weird. I don't know what that reputation comes from, why people are just like, CrossFit's so bad. It's like anything can be dangerous.
Yeah. Anything can be dangerous for sure.
Okay. So I know you mentioned that you had heard the stereotypes, and we talked about that a little, but as an active CrossFit coach, how do you merge those two worlds of fitness and rehabilitation? Because you mentioned, what's the word for like the medical, like, opinion of like, we can give you a pill for that. Like, you're having a problem, we're going to give you medication, but you're focused more on helping the person and not trying to mask symptoms. So how do you merge those two ideas?
Yeah, for sure. So I think a lot of it comes into education. Like, if somebody's coming to me and they have an injury, the last thing I want them to do is stay out of the gym, because then they're going to decondition. When they do want to get back into the gym, their threshold for all of the things is so much lower. So there's always this idea like, oh, I got hurt, I just need to take time off. But really, that's probably the worst thing that you can do is take time off, especially if you're going consistently. So a big thing that I like to do with my athletes when they come in as patients is like sit down and like, let's talk through movements that are aggravating. Like, okay, if it's your shoulder and an overhead press is aggravating, a push-up is fine, a pull-up is aggravating. Okay, so maybe instead of overhead pressing, if that's programmed, we do like a landmine press. So it's a 45-degree instead of an overhead. And if it is a push-up day, you're good to go, send it. And if it's a pull-up day, maybe you do toe spot pull-ups instead of trying to pull up on the rig. Mm-hmm. And that way you can still show up. You can still get a similar stimulus as to what everybody else in the class is getting, hopefully in a similar time domain as what everybody else in the class is getting. And we're going to rehab stuff outside of that. So it's like an and not or of stay in the gym, modify what you need to modify, and do the dang modifications. Mm-hmm. CrossFitters can be very stubborn and will say like, oh, it's fine, I'm just going to push through it. But honestly, that just causes more inflammation and more like prolongs the timeline. So there's a lot of like real talk moments of like, look, like give me 2 weeks where you modify and then let's talk about how you're feeling. And if you're feeling better, then you're bought in and you're going to listen to everything else I tell you. And almost always that helps. And then we do all the rehab stuff outside of that too. And so bridging that way for the people that are coming in. And then as a coach, like from an injury prevention standpoint is like checking egos. Like you gotta check people's egos sometimes. It's like, look, like I know that you think you can do kipping pull-ups, but you cannot because your form is not it and you're gonna get hurt. Like we're gonna modify. And I think that's something that took me a while to get comfortable with, honestly, as a coach. Like for the longest time, I was like, oh no, it's fine, it's your workout. But at the end of the day, like I mean, I would love to see them as a patient, obviously. Financially, that makes sense for me, but I don't want people to get hurt. So
yeah, because you obviously care about people. That's why you do what you do.
yeah.
So do you find a discrepancy in, say, one gender and the other who has the ego problem?
Surprisingly, it's okay. So yes, we all it's totally the men. I think part of that though is coming from a female coach, because sometimes I watch the male coaches and I'm like, are you kidding me? They listened to you? Because I was telling them that for 4 weeks and they didn't listen to me a single time. But I will say some female, I think honestly to do CrossFit, I almost feel like you need to be a certain personality type, like a range of personality types. And there are certain personality types within that range that will still consistently push back.
Yeah.
Okay. I think the biggest thing as a PT, when I was in PT school and as a new grad, it was always oh, well, if patients don't do their homework, it's their fault or whatever. And that's really completely flipped. My opinion is if my patient or my athlete doesn't do what I tell them to do, that's on me for not educating them well enough, or that's on me for having unrealistic expectations of what it is that they can do. So when I give home exercise programs to new moms, I don't tell them I want you to do this 2 times a day for 6 days a week, because I know that she's not going to be able to do that. And I know she's going to be upset about it.
Yeah.
Instead, I'm every other day, 1 time a day, and that's still going to move us forward. Same thing with my CrossFitters. It's hey, look, I'm going to meet you in the middle. We're going to modify as much as we have to, but not any more than that. And you're still going to send it on every other thing that you can do. But I'm asking you to meet me here so that we can move me forward in the grand scheme of things.
That's awesome. Yeah. All right. So empowering clients. You focus on empowering women through rehabilitation. Can you share a success story that illustrates the transformation you've seen in your clients?
Oh gosh, I have so many awesome stories. So I have a couple different offices. I have one office in the CrossFit gym, which is obviously tends to be a lot of CrossFitters or more active people. But I also have offices in birth centers. And for a while, it was offices with chiropractors. And so we have these satellite offices. What we tend to see in these satellite offices is people that maybe don't exercise at all, 0 exercise. And they'll come to us in pregnancy and they're having aches and pains, or they're uncomfortable because their body's adjusting and it doesn't really have the threshold to adapt to all of these changes. And always, I mean, I can list probably 5 to 10 off the top of my head, the people that come in and they don't exercise at all. And then we do some exercise in rehab and they're I kind of like this, I feel better and that's cool. Can you teach me a little bit more? And so then we go a little bit more and all of a sudden I have them doing EMOMs and 12-minute AMRAP of dumbbell deadlifts, overhead pressing, and shuttle runs. And they have no idea that they're basically doing CrossFit or F45 or HIIT or whatever.
Are they doing that in your office, or are you sending them home for that?
Both. So we're doing it there so they can see how it feels. And then that's your homework with whatever equipment it is that you have. And to see that transformation from I'm scared to move because people tell me that I can't and I hurt so bad that I don't want to move, into I want to do more. What else can you teach me? Is so freaking cool and exciting.
Yeah, that is cool.
Oh man, it's so cool. And it's so cool because sure, they're going to do that in pregnancy because it makes them feel better. But then it's I mean, you work out, once you find the thing that you love, you don't want to stop doing it.
Exactly.
You're more likely to continue to do it. So it's this isn't just I helped you feel better in pregnancy, or I helped you have a better labor and delivery, or even I helped you have a better postpartum. It's I'm literally helping you create healthier habits to have a better life, potentially longer life. And that's going to trickle down to your kids when they see you exercise.
Yeah.
And we're just completely changing the narrative that exercise is bad and flipping it on its head and showing them your mom is freaking strong and look at all this stuff that she can do. It is so much fun.
Actually, I saw that you had made some shirts that were mom, was it strong? Yeah.
Which one? I have the Moms Who Lift one on. It's just on the back.
It's Moms Who Lift. And then you have one that was strong as a mother. Yeah, that was cool.
Got the strong as a mother. And then we have strong like my mama.
That's cool. That's cute. I love that. Have you ever had somebody show up at your other office just for the pregnancy stuff and then love it so much that they joined the CrossFit gym?
I wish it happened more, honestly, but we've had 2 members that are at the gym now. Actually, one of them moved, which is very sad. And then the other one just had another baby, so she's hopefully coming back soon. But we've had a couple members join, and we've had people like drop in. And like I have people that drive to me from decently far away, like up in Magnolia or like 40 minutes away into Houston. So we've had a ton of people that even if they don't join our gym, they join a gym close to them.
That is awesome.
I'm trying to pull everybody. I'm like, we have time here. Look at this. Look at that. And they're like, it's 45-minute drive. Okay, that's fair.
Yeah.
I wouldn't make that drive either.
That's so cool though, because like you said, they come in with like no experience at all. And now they're like, okay, sign me up. Like you really are impacting people in such a powerful way. And that's so cool.
It's really fun. It's so cool. And like, it's not lost on me how freaking cool it is every time it happens. Like, it's just like, dang, I'm so proud of you. Like, look.
Do you like start to tear up?
Yeah. Also, sometimes I come home and I tell my husband, let me tell you on my day today.
I'm the same way, but on a less cooler scale. But I remember when I was coaching at Overtake, I had helped a person get a pull-up for the first time. And I remember telling them the week before, I was like, you're going to do pull-ups next week, because she was already so close. And then the next week she came in, and I literally had tears in my eyes. I was like, you cannot cry when you're coaching. There's no crying in CrossFit. But just that proud moment of like, yeah, you did it, you know. It really is. Oh, I have chills. Okay, so balancing the role of being a parent. So how do you balance being a mother of two and a business founder and a CrossFit coach? What strategies do you use to maintain your own health and wellness amidst being so busy?
Yeah. So I just did a blog post about this, about like how to keep it together. And actually it's because I don't keep it together. But I think that a lot of it is like enjoying the fact that it's messy and it's a journey, right? So I have two kids that are 4.5, and then my son actually turns 2 on Friday. And I'm heartbroken because I don't want him to grow up. But it's like, I have shifted, like everything has evolved over the course of all of this. Like when I started Disrupt, I didn't have a kid yet, but I was pregnant with Olivia. Then I had one baby, but a lot more time freedom. And then I had a second baby, and then it just like completely flipped on its head. I expanded my business at the same time. Like all of these big things happened. And in that process, like that year of like having Nicole, bigger office, more employees, it was like, what is it that I even want? Like, this grew so quick, and it was like, is this even my vision, or is this what I feel like I should be doing? Because like, that's what you do as a business owner, as you grow and you expand and you do things. And I had this really hard, like, sit down moment with myself of like, is this what's making you happy, or is it not? And it wasn't. And so I scaled back, and we left the bigger office and went back to just our small satellite offices. And we had tried to get pediatrics on board, and unfortunately that didn't work out because we had an amazing pediatric PT who was fantastic, but shrunk down that side of the business. And it was like, okay, now I have kind of this balance again. And so that was like lesson number one, is like, don't chase what other people's expectations are. And that falls into parenting too. So like there was even earlier this year, I was like, okay, I need to keep my kids home 2 days a week. Like we need to pull them out of full-time daycare, put them in part-time daycare, so I could be with them 2 days a week and on weekends, because that's what I feel like I should do. Like, otherwise, I'm not a good mom. I can't be like a working mom and a stay-at-home mom without doing this balance, kind of. Right. And so we did that. We pulled them from the full-time daycare that they were in, that they loved, put them in a part-time daycare that was garbage.
Oh, no.
And they didn't want to go. Like, they were crying. We dropped them off, and all. Well, great. Like, I pulled you for my selfish reason of like, I want to spend more time with you. You hate where you're going now. I'm stressed because I never have time to myself, because I'm either with kids or I'm working. And now, like, none of us are happy. So yeah, it was like another, like, okay, sit down. Like, what is it that we want? And so revisited, we put them back into a full-time daycare that they love. Literally, when I picked my daughter up, she's like, it's not late enough. You need to have that later. Okay. So they love it. And I get the ability to have time to myself to like leave my house or like go to the doctor or go to the grocery store outside of all of the things I do as a mom, so that when I pick them up at like 4 o'clock, I can be mom. And so from like 6 a.m., sometimes 4 a.m., like this morning, until they go to daycare, I get that time with them. And then they're in school and I'm at work. And then from 4 until the evening, I get that time with them. And so just finding that balance of like, what is it I want my days to look like and what fills my cup, and not stressing about like, well, this isn't like good enough or enough of anything or whatever. And then the other piece of it is I'm just really lucky to have a really supportive partner. So Bobby is fantastic. Like, he does so much. He's super dad. And like, anytime I have stuff that comes up in the afternoons, he's like, it's cool, I got it. Or I travel, like I teach continuing education 1 weekend a month. And he's like, yeah, go. Like, book your flight early Friday morning, come back late Monday. Like, I've got it. I'll hold down the fort. And then I do the same for him because he travels for work. And so it's just this like really respectful balance where we just like compliment each other and help each other out, because we know like some days we're going to be the one that's stressed out and it's hard. So like, I'll pick up the slack for you this day while you're having a bad day, and just kind of having that balance is really nice. I think like parenting is a team effort. And if you're not dialed in as a team, it just makes it 10 times harder.
Yeah, I can't imagine. Honestly, like even just not having kids, I'm working full time, I'm in grad school, and I was coaching, and then just making time for myself to work out, like that was the first thing to go.
Yeah.
And then if you have that guilt when you miss a workout, you're like, oh, I know I need to be working out. Like, how can I sit here and have a blog and a podcast about working out when I'm not doing it? But it's the first thing to let slide. So do you find that happening to you?
It did, for sure. Especially like earlier in the year when I was really like kind of like spiraling of like, what is it that I'm looking for? What is it that I'm trying to do? That was part of my frustration, is I was like, I'm doing all of these things. I have all of these balls in the air. I feel like I'm not doing any of them well. And I'm working out like 2 days a week, maybe. And it's usually by myself. Like, I'm not even going to classes. So I'm not getting the community aspect of it. And so that was another big thing. So now what I found really works for me is kind of similar to like scheduling. Like, okay, I've got kid time, work time, kid time. I have workout time within my day. So like, I'm fortunate that I can plan my own schedule. And so I build into my day, like, okay, I'm either going to do 9 a.m. this day, or 10 a.m. or noon or 3:30. And if none of those work out, like, I'm going to go to 5 or 6 a.m. And I have my goal of how many days a week I want to go and just focus on hitting that goal. Right now it's 4 days a week. Some days it's 5 days a week. That's great on those weeks. And on the days that it's 4 days a week, that's great too. And sometimes it's 3 or 2 days a week, because life happens. And I think I've just figured out how to find the balance of like, it's okay, exactly like you said, to not beat myself up. Like, I didn't do a CrossFit class today because I had some stuff in the morning, patients, some stuff afterwards, meeting wise, and then we were recording. I was like, I don't want to do my one free hour that I have today. I don't want to spend in a CrossFit class, because I'm on still, even if I'm not coaching. It's like, you're talking to people, you're doing all the things.
Yeah.
And then go do the podcast and just be wrecked by the time I get home.
Right.
And so my husband and I went on a run, and I hate running, but it's what sounded nice today.
I was going to ask, on the days that you don't go to the gym, if you do try to do something else.
Yeah. Like, we'll take the dogs on a walk with the kids, or take the kids to the park and run around. Like, it's very rare that I have just like a straight up sedentary day where I do absolutely nothing. But on the days that I don't do CrossFit classes, it's like, okay, like, what way can I move that's going to make me feel good? We've also been really into yoga lately as a family, which has been so fun. So there's a YouTube channel called Cosmic Kids, and they do themed yoga. So they have like Trolls yoga and Frozen yoga, and she dresses up in costume and tells a story, and we all do it. Like, the kid, like Nickel, little 2-year-old, like, is over there doing like warrior pudding and stuff. So it's fun.
Do your kids dress up for the theme?
They would if they had but no, they don't.
That sounds fun. And then with yoga, I'm sure you're like, oh, this is helping my muscle, whatever muscle, right?
You're trying to turn my brain off when I do yoga, but I'm bad at that.
Awesome. All right. So talking about parenting, I had a friend of mine a couple of years ago who her husband owned a gym, and they had three or four kids. I can't remember. It's been a few years, but we didn't see her often in the gym. And I remember talking to her one day, and I was like, hey, where have you been? Like, you used to work out? And she was like, well, I just have a hard time like doing things for the kids. And I feel like if I do make time to work out, and she just threw this word at me, mom guilt. And I was like, mom guilt? What is that? Like, how's it different from regular guilt? So what is mom guilt to you? And then have you experienced it? And if so, how did you overcome it?
Gosh, the mom guilt. It's so bad. Yeah. So I had terrible mom guilt up until like this past year, honestly. So mom guilt, I mean, I think it depends on the person that you're asking, but it's exactly that. Like, I don't want to take away time from insert or for insert thing that is for yourself because it feels selfish to do that and take away time from your kids. So whether that's like going to get your hair done or getting your nails done or going to dinner with a friend or going to the gym, I can't do it because it means I'm not there for my kids. And the hard part about mom guilt is one, a lot of the time we do it to ourselves. Like, I know I personally, like, I would never go out on a weekday with a friend or even a weekend for dinner. Like, people would invite me out and I'd be like, oh, okay, like, let's talk about it. And then I never schedule it. And I wouldn't even like pose it to my husband because I was like, no, because then he's going to have to put the kids to bed by himself and he's going to have to do all these things. But I never asked him. And so it's like one day I was like, okay, like, I'll just ask him. And he was like, yeah, like, there was a day that I had like a breaking point of just tears because it's like, I don't feel like me anymore. Like, I can't do anything that makes me happy because all I do is pour into the kids and I pour into our relationship because I still want to be a good wife and I pour into people at work and like, what's left? And he was like, why don't you do that? Like, I can get up early with the kids so you can go to the gym, or like, I am very capable of putting our children to bed so that you can go to dinner with your friend. And it was just this moment of like, oh, like, I don't like, in my mind, I had created that he was going to feel burdened. And so I didn't even try to ask him. And then on the flip side, like thinking like, I can't take time away from like my kids to go exercise, even if it's like 5 o'clock in the morning. Well, they might wake up at like 5:30, but then I'm mad the rest of the day that didn't get to exercise.
Right.
And so then I'm snappy at the kids and I have short-tempered and like my best parenting doesn't happen on the times when I've been sacrificing everything, quote unquote, for other people. And so it's like the whole plane analogy, like you got to put your own oxygen mask on before you put on somebody else's.
Yeah.
1000% in parenting. Like, you have to take care of yourself. Like, you have to do the things that give you, obviously, like, don't run off and do whatever and like neglect your children. Like, nobody's saying that.
Right.
You can't show up for yourself. You can't show up for other people either.
Right.
Like, you're pouring from an empty cup.
And then you have the long-term effects too, where if you just quit working out because of the mom guilt, then you're going to be unhealthy and then potentially not be around for your kids, or maybe not just to be able to play with them. So yeah, I like that analogy you used of putting your own oxygen mask on first. And I think that's obviously, that applies to moms, but even people who are, say, like in codependent relationships, that you have to make time for yourself, or you're gonna have resentment for your partner. You're gonna feel like they're holding you back and they're not letting you do what you need to do. And so at the end of the day, all of us need to take care of ourselves first so that we can show up for the people we care about.
Yeah, 1000%.
I like that. Okay, so misconceptions in therapy. What are some common misconceptions about physical therapy, particularly in relation to pelvic health? I know we started talking about that, but we're going to circle back to it. So yeah, the misconceptions about pelvic health.
Yeah. So physical therapy as a whole, unfortunately, I don't feel like it's a misconception, but it's typically most PT places, it's very like underdosed, and you're going to sit in a corner and do exercises by yourself while 3 other people that your PT is seeing are doing their own exercises. You're going to use like a little yellow stretchy band, and that's all you're ever going to do.
That was me. That happened when I tore my hamstring.
Yeah. So the company I teach at, we like to call that PT 1.0. So that's like your base level, like PT. So it exists, but what is not really known is like there's better out there, right? Like, just like there's good and bad people in every profession.
Sure.
Great PTs out there that are delivering like high quality care to get people back to the things that they want to do and like actually getting them there and not just wasting their time. I think another misconception is like the old school, like PT's pain and torture, like it should hurt and it's going to be miserable and terrible. Like, it shouldn't be. It should be like an empowering, collaborative experience. Like, it should be both people coming together to talk about goals, working towards those goals together.
I don't know if I fully agree with you on that last statement. I've done some of your PT, and those resistant bands,
They get spicy.
oh, they get real spicy. Was it the banded walks? Oh my gosh, I was feeling the burn.
Booty burn. You're welcome.
Right. Yep. Yep.
It's all for the benefit.
Beauty is pain.
Something like that. In the pelvic health space, I mean, you hit on one of them already, that like pelvic floor issues are only for people who have had babies. Pelvic floor issues can be adolescent athletes. It can be women who haven't had babies. It can be men. It can be menopausal women. Like the spectrum of pelvic floor dysfunction isn't just in this one season of life, even though that's the season that gets all the attention. And then kind of piggybacking on that, it's like, okay, well, you've had a baby, so it's normal to have XYZ symptoms for the rest of your life. Like, you just have to live with it. I remember my mom, still to this day, and now I just tell her, like, there's people that can help you with that. When she sneezed when I was a kid, she was like, dang it, Rachel, this is all your fault. So she would leak. And I was like, I don't understand what you're talking about. Like, I made you sneeze. And then I got older and I realized she was talking about keys when she sneezes. And hopefully she doesn't listen to this. She'd be like, Mom, or Rachel, how dare you? But anyway, like, that was just seen as normal. It's like, okay, well, you had babies, and so you're just going to do this for the rest of your life and go change your underwear, I guess. But that's not the case. Like, we can treat pelvic floor issues at any point, and it doesn't have to be within a certain timeline. So again, I tell my mom, like, hey, I know I'm 33 years old, but you could still get pelvic floor PT for that, and it would still be helpful and beneficial.
Okay, I have a really dumb question for you. I just want to remind the audience that I have a degree in English. I don't know anything about anatomy. You said men have a pelvic floor?
Yeah.
I didn't even know that.
So, oh my gosh, this is like my favorite thing to, like, the soapbox of like the lack of education we have about our bodies and like human bodies, right? Like, obviously, like, we maybe know a little bit about our own bodies, but like, aside from the things that we need to know about a male's body, we don't really know. So yes, pelvic floors, men have pelvic floors. They are similar muscles, like similar functions of muscles, arranged differently. So obviously, like, some are elongated in males versus shorter in females. Female pelvises have 3 openings and males only have 2. So we have urethra, vaginal canal. I was trying to say vagina and vaginal at the same time. It came out here. And then anus, and then men just have urethra and anus. So they're just missing that one hole.
Okay.
But functionally, the way they operate is very similar.
Well, if that question wasn't dumb enough, I have an even dumber question. So if men have a pelvic floor, can they do Kegels?
Yes,
they can.
Yes. So the cues are really funny. My favorite cue for male Kegels is nuts to gut. So like, if they were walking to a cold ocean, the like feeling that they get.
Okay.
Kegel. Scientifically proven from a research standpoint, the cue that is supposed to elicit the most intensity of a pelvic floor contraction for men is shortening your penis. So yeah.
Interesting. I've learned a lot today.
I also think my favorite cue across all genders is squeeze your butthole, because everybody has to do that.
Oh my gosh.
This is my life. We know, we have evidence for the fact that like lack of education and lack of knowledge about the pelvic floor is related to pelvic floor dysfunction. So if all we've ever been taught our entire lives is like, don't think about this area, don't touch this area, don't look at that area ever until you're married, and then like figure it out, then that sets us up for potential dysfunction down the line.
Right. Yeah, because if you don't talk about it, then when something goes wrong, you just let it keep being wrong, and I believe education is very empowering.
Yeah, for sure. And it's impactful. Like, we can change people's pelvic floor dysfunction just through education, not even doing anything else. Like, adding the other stuff in makes it even more, but like truly just education alone can change people's symptoms.
That's awesome.
That's pretty cool.
Okay, so we are going to move on to advice for new female athletes. What advice would you give a woman who might be starting their fitness journey for the first time, like as far as what to expect, maybe good things and bad things? What would you tell them?
Yeah, my biggest piece of advice is fuel appropriately. Like, it is unfortunate how many people are under fueling and then trying to layer in exercise in order to try to look like whatever standard it is they're trying to look like. And when we do that, we end up putting our body in what's called relative energy deficiency in sport, or REDS. And that causes like a myriad of issues. So it causes hormone disruption. it can cause mental issues like that brain fog and difficulty concentrating and clarity. It can have effects on bone density, like lots of downstream effects that can happen that all stem from this like toxic diet culture and culture of underfueling. So I think that's the number one thing is like food is fuel and food is what our body needs in order to produce effort.
Yes.
So that is so important. And like realistically, people are eating the calorie numbers that my toddler eats. Like 1,200 calories is literally what my 4-year-old has. And so like understanding like what the appropriate number of calories is and then ramping that up if you're layering in other exercise is incredibly important. Like that's the number one thing. And it doesn't necessarily mean like you have to go and shell out a bunch of money to work with a nutritionist per se, but just getting a baseline understanding and like feeling well, eating well. Don't just go out and eat like 10 Big Macs because you're trying to hit calorie goals, but making sure that you're getting good quality food in to balance out the activity.
And prioritizing protein.
Protein, yes, for sure. And like carbs are not the devil. It's
right.
Fat is not the devil.
Exactly.
Everybody needs fat. Like all of these things are on this earth for a reason. And like whole foods, like airing towards whole foods, I could clearly go on a soapbox tangent about that.
Same.
So nutrition is the biggest thing. The second thing that I think I would say for female athletes is like, don't get caught up in the comparison game.
Yes.
It's so easy to do.
Yes. Even if it's with yourself sometimes, because you may have been like your most fit 3 years ago and then seasons happened and you couldn't prioritize the gym and now you're comparing yourself to yourself then. And even that, but then there's the other comparing yourself to people who have been working out much longer than you. And yeah, that's a trap. Don't fall for the trap.
Yeah, literally. It's hard to get out of that one.
Just set your daily, like, my goal is to show up today and do my best. And then you keep doing that every day. And before you know it, it's been a year and then you're so much better.
Totally. I love that.
So I had one person reach out with a question about when they're working out, how do they know when you work out, sometimes it's uncomfortable. It's supposed to be uncomfortable. How do they know when that uncomfortableness is, or discomfort? Yeah. When that discomfort is the right kind and when it might be an injury.
Yeah. So I think kind of like delineating what it is that somebody's feeling. So like, for example, in a workout that has like a ton of wall balls, like your legs are going to feel heavy and like they're burning and like that lactic acid is building up. But it's like one hip is pinchy and the other one's not. Like that's not a workout like, oh, I'm just going to push through this discomfort kind of thing. Or same thing with like shoulders. If you're doing pull-ups and like consistently when you do pull-ups, your shoulder is achy afterwards and it's only one side, especially. So anytime it's one-sided for sure, that would be like a big red flag. But then like what it is they're feeling, like, is it fatigue? Is it tired? Is it heavy? Is it that like lactic acid burning sensation? Or is it like pain? Because I would argue that there's really never any time when like pain, like joint pain, muscle injury pain is normal in a workout. Discomfort of like, oh, I kind of like, I'm pushing it is one thing where you're feeling it globally in the region it is that you're working. But if it's starting to look like, okay, consistently this pattern is happening where I'm feeling discomfort with this activity when I do it, especially if it's one-sided, that would be a reason to modify that movement.
Okay.
Gym,
yeah,
come see me.
Yeah, I guess I shouldn't work out now, right? Yeah, don't do that. Yeah. Okay, so what about if you're in a workout and say your legs are just really shaky? Like your legs are tired, as heavy leg day or whatever, and your legs are shaking. Is that a sign of an injury or is that a sign of you're doing what you're supposed to be doing?
Yeah, like neuromuscular fatigue for sure. So sign, a fancy word for yes, like you're working to the point where you're like bone tired, like it's fatigue.
So that's good.
Good per se, like depends on what the stimulus of the workout is for sure. Maybe that's a situation where that person maybe should scale back slightly and get to like a point where they can work where they're not like physically convulsing.
Like that question wasn't for a friend, that was for me. Like last week I was like, I've never seen my leg shake like this before, am I okay?
My right leg like literally goes like this every time I come up. But I also have, I was literally just telling Bobby this earlier, my right ankle's probably swollen. I get right SI joint pain that comes and goes. I have right ankle swelling when I run. So like my right side is is not biomechanically as good as the other side, quote unquote. And so it takes the brunt of things. And then I feel the aches and pains go on. It doesn't mean I'm like injured, right? Like I don't have an injury. I'm just, there's an imbalance between my right and my left. And I know when I work out what's potentially going to flare it up. So like last week or 2 weeks ago, I can't remember, we've been doing these really exciting, and by exciting, I mean painful 30-minute EMOMs on Tuesdays. So it's like 40 minutes of 4 movements with 10 rounds.
Oh my gosh.
Yeah. And one of the ones that we had recently, it was like burpees over a line, lunges, like weighted lunges, handstand walks, or like flipping up and doing shoulder taps and skier. And so a lot of those are like movements that will flare up my SI joint if they're individually high volume, but then when you put them all together, like the burpee having to step up and then flipping up is a big trigger for my glute pain that I get. And then my lunges, like all 3 of those things back to back to back. 2 rounds into the workout, I was like, okay, I'm going to air squat, or I'm going to goblet squat with this heavy weight instead of lunge with it. Because I do want to work on my handstands. And so that's what I'm going to prioritize. I'm going to take the lunging piece off of it. And then on the burpees, instead of stepping, I'm going to jump every time. And so making those like within the workout tweaks, I still finished. So that was like 8 minutes into a 40-minute workout. I wasn't like, oh, this hurts, I'm done. I was like, okay, let me just like tweak this a little bit and still continue to work out and still hit on the thing that I know that I need to get better at, which is the handstand part.
See, that's why I love CrossFit, because you can really just modify, like the workout's there for you. You don't have to come up with a workout, but you can modify it and whatever needs that you have. Yeah. And that's one of my favorite things about CrossFit.
I agree. And that's what I like, man, even now, like I hear all the time when I get patients that don't do CrossFit, they're like, you do CrossFit? That's scary. I'm like, you should do CrossFit. Like, you could walk into my gym tomorrow having never done CrossFit in your entire life, and you and I could do the same workout. I promise you.
Yep.
And you would be tired, but you would have a great time. Like, it's so scalable. And I think like the general population obviously just doesn't understand that.
Right.
And it's sad. Like, it's an unfortunate like stereotype that goes along with it. Because I think that that's like Glassman's whole big thing that he's doing with like all of the weird secret underground stuff that's happening right now. Well, push it back towards health.
Yeah, because a lot of people only know CrossFit from the CrossFit Games. So they see these professional athletes doing these insane things like freestanding handstand push-ups. And they think, what, these people are crazy. Well, we're not all doing freestanding handstand push-ups. Exactly. And they didn't start out doing that either. They probably started just up on the wall doing kipping handstand push-ups like everybody else, or even just pike push-ups.
They were a beginner at some point too. Right. You know, funny. We went, so Bobby and I did BCS Classic, which is like a local competition, relatively local competition. And my in-laws came to watch and also to wrangle our children because we were on a team together. And my in-laws were both like, wow, like that's what you guys do when you work out, because we did like 5 workouts in 2 days, and they were just like mind blown. And so then 2 weeks or 3 weeks or whatever later, we went to the games, and they were like, oh, so you guys competing? And you were like, watch for the penny, and you don't know how funny it is. Like,
yeah, we go on in 5 minutes.
Okay, thank you. I wish you knew what it was and got one, and also how hilarious it is. But yeah, just they don't understand. They don't have that perception, and all they see, you're right, is the games. They don't see all of the lives that have been changed by the CrossFit methodology in like just astounding ways.
And if you walk into a gym, you see the people who look like they could be in the games, but you also see regular people. And they're all working out. Like you said, they're all doing the same workout. It might be varied based on skill level, but everybody's there doing the same thing. And that helps contribute to the community aspect, because you know, if you're the last one, I personally hate this, but if you're the last one to finish a workout, people aren't just like, okay, peace. They're like, come on, Brandy, you can do it. And like I said, personally, I'm like, go away. But then at the end, you're like, okay, thanks. You know, and the people care for each other there too. 100%. Okay, I have to ask, what legacy do you hope to leave through Disrupt, both for your clients and the broader wellness community? What impact do you want your work to have on future generations?
I want Disrupt to change the way people look at pregnancy and postpartum, for sure. Like that's a big one. I want our greater Houston area to understand what it means to support women in exercise and in their health journey. And I think that we're making that change for sure. It's really exciting. Like the things that we hear from people that their birth providers have told them is so different than it was a year ago or 2 years ago before we were really like sharing this common language and being able to educate on a lot of things. And so locally, that's the reach that I hope that we can help change is like, okay, like we're empowering women. Like empowerment is such a big word in my life. Like it's literally like my drive is to empower other people, whether that is through coaching or through injury or through pregnancy or whatever that avenue is. And so I hope that it is kind of what we're seen as and, not even just in the pregnancy postpartum space, like across everything, like in the CrossFit space, in the general orthopedic injury space, like all of it. That's what I want us to be known as is like, they are doing the thing. They are knowledgeable. They know their stuff and they're helping me be a stronger, more resilient, more capable human. And that's what I want, like that our brain to be synonymous with.
Well, I think you're well on your way with that. You got all the acronyms to go with it. Right. Is there anything else you want to share with our audience that maybe we didn't talk about today? Okay. I had a lot of questions, so.
Awesome. I think it's just, I feel like obviously it's my business and it's CrossFit and it's pelvic. It's all these things that I'm so passionate about. I love getting to come on and talk about and educate. Like you learned some things.
Yeah, I learned a lot.
But I think the biggest takeaway is like education is so powerful. And I think like if we can educate people, we can remove a lot of fear and a lot of questions and a lot of assumptions in a lot of spaces, not even just in the pelvic space, like with nutrition, with movement, with all of these different things that we could do. And so I just think like the ability to get on podcasts like this and talk about all of this stuff is just so amazing. And I appreciate you inviting me.
Oh, I'm so honored that you agreed to it. I was like, Hail Mary. And I'm so glad you're here. That's awesome. Thank you so much for joining me and sharing all your knowledge. You might just be the smartest person I've ever met. Well, thank you again for tuning in to the Gym Bag Journal. Thank you again for listening to this episode of the Gym Bag Journal podcast. If you want to know more about Dr. Rachel Moore, you can visit her website at www.disruptphysio.com. That's disrupt, PHYSIO.com, or follow her on Instagram at Disrupt and Wellness. Also, if you want to hear more about the Gym Bag Journal, you can check out my blog at www.thegymbagjournal.com and follow me on Instagram at the Gym Bag Journal. I hope you enjoyed this episode, and we'll see you next time.